Hi, my name is Amaris Caruso. I work at MSH on the Health Economics and Financing team. A managed inter-agreement is a type of formal arrangement between a pharmaceutical company and a payer, usually a government, to introduce a new product or medical technology into a health system. These arrangements are important because they can increase access to high-cost treatments, especially in the case of cancers and rare diseases. And through these arrangements, the financial risk of introducing a new technology is shared between the pharmaceutical company that produces that technology and the payer or the health system that is interested in purchasing that product. And this is particularly relevant to Latin America because these countries suffer from the double burden of disease, meaning that they have an important presence of communicable diseases and also an increasing incidence and prevalence of NCDs. And as a consequence, they have to tend to multiple priorities with the limited funds that they have available. For a managed inter-agreement to succeed, the country context is key. It is very important to have political will and knowledge around this policy among the key stakeholders within a country or health system. Another condition is the capacity of the health system to negotiate and regulate these agreements, as well as a legal framework that allows the implementation of this arrangement. MSH has been contributing to this work in Latin America since 2020, and we wear two hats in this space. The first one is providing technical support in countries such as Colombia as they start the process of adoption of managed inter agreements. In the case of Colombia, we worked with the designated working group within the Ministry of Health to review the legislation and check if these types of arrangements were allowed in the country. Since there wasn't a legal framework, we then provided support as they drafted, refined, and published a new legislation that allowed these agreements. The second hat that we wear is as facilitators to provide trainings to relevant stakeholders in countries such as Ecuador, Peru, and Mexico to strengthen capacities around managed inter-agreements, raising awareness about the different options that exist to incorporate new technologies and increase access to high-cost treatments within a country without threatening the financial sustainability of the health system is a duty that we have as an implementing partner. One trend we see in Latin America is that once a country adopts a new policy around market access, others become interested in exploring the possibility of doing the same. So with examples of Colombia and Peru, there is an increasing demand in the region to strengthen capacities around managed inter-agreements. One example of this is the implementation of health technology assessment, in which has been adopted in high-income countries first. Then Latin America followed with the implementation of this policy in many countries. And we see now in recent years that Africa has been creating health technology assessment units. So we expect the same to happen with managed inter agreements.